start our journey for epidemiology, biostudies, and research. And I pray the Almighty that we should be enjoying these sessions and also utilizing this for our own progress, welfare of the people, and benefit of the world. Now, uh, let me start how and why we started this. Basically, when we were thinking of helping the voluntary organization and government, we thought let us start with this kind of course so that it is helpful to all. Usually, we teach in medical college and as a separate subject, epidemiology and biases and research, etc. But when it comes to the voluntary organization, they uh, require the things together, and uh, learning separately makes it more difficult. While learning in a group and learning together and also subject in integrated way makes it more interesting. And I'm sure that at the end of the sessions, will be all individually will be ready with uh, individual projects, and we may try to come up with some multi-centric project which all of we can do it before our the sessions are over. That means before the end of July. So 31st July ke pehle, if we can do something, that will be better. Now, before I start this uh, course, I'll be introducing each subject, what we are going to do. And if possible, you may write down in your mobile or in your notebook the action points so that because there are only 10 sessions, we can't, we can't, hello, any problem? Someone is, please mute your mind. So, we'll be working in between also. It's not that only doing sessions will be working. So, first I introduce myself, then I need a quick introduction for each participant in just a few seconds, and then I'll be talking with you what we are going to cover. So, uh, uh, my introduction is Dr. Rajesh Mehta. I've done MBBS and then MD in community medicine and working in field for last 44 years. And this is a subject which I like most. And I will name and then the person should give a quick introduction. So what is your qualification and where do you work? Right now I'm working independently for this virtual medical college and not physically attached to any medical college. Uh, now Vamsi Krishna, please introduce yourself. If possible, you can unmute your mic and also you can do a video on at least for a few seconds. Vamsi Krishna,
Yes, sir.
yeah. Your
Sir,
introduction, please. Yeah,
Om Sri Krishna. I am from Andhra Pradesh, sir. Vizag, Visakhapatnam.
yeah. What's
Uh,
your educational background?
so MSc Medical Pharmacology. I am doing PhD.
Yeah.
So I am working as tutor in medical college,
So
NRM
next,
Medical
Nidhi.
College, sir.
Okay, thank you.
Sir,
Next, Nidhi.
next.
Yes, so I have completed my MBBS and then I'm pursuing my master's in USA and my major is epidemiology and currently I'm also working as graduate research assistant in biostatistics lab. Thank you.
Next, Sandeep.
I am currently working as an assistant professor at BJ Medical College, Ahmedabad.
Education.
MBBS and MD Pharmacology.
Okay. Dr. Shruti. Yes, please. Dr. Shruti, we can't hear you. Okay, we skip to the Ruchi. Ruchi, can you introduce yourself? Any problem? Soumya?
Good afternoon. I'm Dr. Soumya. I'm currently doing post graduation in community and family medicine from AIMS Raipur.
Okay. Riddhi, you can also introduce yourself. Okay, next. Yoga Vigneshwar. Please introduce yourself.
Hi, doctor. I'm Dr. Yoga Vigneshwaran. I'm from Vellore. I'm a PharmD graduate, and also I'm an upcoming student from London School of Hygiene and Tropical Medicine. I'm gonna do MSc Public Health at UK. Thank you.
Saranya.
Uh, yes, sir. I'm Saranya from Apollo
Hmm.
Medical College, Chittoor. I'm a senior.
Okay. Someone left out. Dr. Sudhir, can you introduce yourself? Is there any possibility?
Yes, am I audible, sir?
Yeah, yes. Very good.
Yeah, I'm Dr. Sudhir Kumar Jha. I have done my MBBS and MD in community medicine. I have done my MBBS from GMC Nagpur and then MD in community medicine from DHU. And now I'm working as Associate Professor of Community Medicine in SSR Medical College, Mauritius.
Good. So you are also faculty of this
Yes.
course. Okay, Ruchi? I don't think she is probably. So let me start with what I wanted to continue. So basically, we are going to conduct this thing in a integrated manner, and I think we should be very clear that we are learning this to enjoy the life, nothing at the cost of enjoyment. And while we enjoy the life, we build up in such a way so that the happiness and the peace increases, not that so much as ups and downs. And basically, statistics, research, etc., or even epidemiology is basically forming an opinion. But that opinion can be just a layman opinion or learned opinion like that. And once you build opinion, if you are confident enough, then you give it to others rather than directly jumping on the vague judgment. And if we go through this course, naturally, wherever we are doing our job or whether we are doing our business, once our judgment becomes more powerful, then more likely that you will be succeeding in job as well as business. And ultimately, we want to find out the truth. So statistics will talk about the probability, how far could be the true. So rather than yes and no, it could be. Statistics will not say yes or no, but what is the likelihood of yes or likelihood of no? That will come to no. And this is just like a game of judgment. And what I uh, recommend that, suppose you want to take a weight of few individuals. While you take a weight of few individuals, what you should be doing, that first you try to take a judgment. This fellow seems to be a 55 kg. Now take a measurement, measure it, and then you say, yeah, it's 70 kg. Then again judge that if this is the case, instead of 55, I should judge as a 70 kg. For any kind of measurement, if we make a habit of prejudgment, measure it, verify it, and then again, why my judgment is wrong? And then in such cases, for most of the parameters, your acumen will increases. Similarly, when it's the difference between two sample, the for example, one sample you're talking about the hemoglobin level, other sample is another hemoglobin level, right? And Of course, once you apply statistics, you will be clearly knowing whether the judgment you are is significant or not. But if you try to develop a gut feeling, then apply the test, and then again try to say how far you are wrong. This way, your judgment and your mental exercise will lead you to a certain level so that your judgment increases quickly. Then nowadays, statistics is not only for test of significance, etc., etc. Now, predictive statistics is now to be used for machine learning and artificial intelligence. Although there are various sensitive tests, etc., but we need to understand where to feed what, and that's why the learning will be helpful. I will give you an idea of image processing. Now, for the newborns, weight assessment or height versus chest circumference, or let's say even head circumference, everything can be measured by combining this image processing with help of artificial intelligence. No need for weighing machine, etc. You just take a video, send for the analysis, and you will come out with the judgment that what will the likely weight, what will likely height, or in case of newborn, we use the word length instead of height. And then also suppose you are taking a food dish and you want to find out how much calorie proteins you have taken. If there's image processing video is taken, and it will measure the amount of the vegetables, amount of roti, etc. From the color also it may identify which kinds of vegetable, which kind of dal, etc. So, and then based on the data, it will calculate that how much you have taken. It can measure your speed of eating, whether you're chewing properly or not, whether your forehead is in tension or not, the creasing is there or no creasing, something like that. Everything your dietary pattern can be analyzed by this kind of image processing. Now, there are lots of non-invasive tests are going on. For example, we have found out vitamin A deficiency detection machine without taking blood. And if you want to compare it with the blood test, so whether it's what is the sensitivity and specificity that we need to measure, or you may have to develop one regression coefficient or regression equation so that based on non-invasive you can talk what will be the ideal value. So that also the statistics will help us. Then initially, if you look at the world as goes on, we had very few variables in our environment, in personal life, in social life, etc. But now, as the world is moving fast, global village is being developed. There are so many factors. Pathis are also many pathis: Ayurveda, allopathy, naturopathy, Alexander therapy, or something like oxygen therapy. So many things, and we want to find out what is working and what is not working. And that's why multivariate analysis is must. In that also, there is a recent survey says that 50% of the Indian people are using Ayush, Ayurvedic therapy or homeopathy, etc. So as an allopathic doctor also, we need to see what kind of interaction is taking place with other pathies and the human being. So we develop the human concept. H stands for homeopathy, U stands for Unani, Siddha, and all other systems. N stands for modern medicine, A stands for Ayurveda, N stands for naturopathy. So we are developing the human healthcare system, and human health circle is basically meant for integration, giving best to the people. And we should keep the purpose of life in mind. Why we need to go for the truth with help of statistics, epidemiology, or research? Because then it will be much easier for spiritual progress of not an individual but a society also. And while interpreting, it should be very clear that if we know the purpose of life, then our perspective will be right. Suppose the WHO has given you a grant or some company has given grant. That doesn't mean that we should be having a bias to help that company. That can help, that ethos we can maintain provided we know the purpose of life. And the interpretation, intention, everything should be clear. then only the statistics will be help us in arriving the right thing. If it can be used for other way around, your statistics may be right, but your intention is wrong, then it can create a problem. Because I will give an example. Whenever there are variables are there, which is a simple measurement variable, you are measuring something quantitatively, and then you are making a group as you wish, not as per the standards. So that by keeping a group like that, you have a lot of advantage. For example, weight 5 to 10 kg, 10 to 15 kg, is that you are not matching properly. So what you do, 5 to 9 kg, 9 to 14 kg, like that. So now at globally people say that this kind of grouping based on the quantitative should be avoided. Rather, we should go for the mean rather in proportion whenever it is possible. So our intention should be very clear. Now in epidemiology, when most of the literature, which is very simple to understand, will be shared with you, but the most important thing in epidemiology, what I would say that we should be integrating with the help of one book, which is known as A.B. Hill Textbook of Statistics. There are a lot of examples given in this book, Textbook of Statistics, A.B. Hill, because then you will realize that how the biases are occurring and how it can be useful. I will give one example. The doctor, physician came with me happily that, see, doctor, I have found out something whereby I can find out the glycosylated hemoglobin just with help of urinary creatinine level. I repeat, he claimed that he can find out glycosylated hemoglobin in the blood based on urinary creatinine level, so that there is no need of measuring the glycosylated hemoglobin. Okay, I thought, let me check your data. I used the software AP Info and we applied this test. And when we removed the compounding factor, there was no relation at all between urinary creatinine level and the glycosylated hemoglobin. The association was because as the age increases, the urinary creatinine level was increasing. As the age was increasing, the glycosylated hemoglobin was increasing, and there was no independent correlation between these two. And so I said that please try to remove the confounding variables also. So most of the time, people go for a 2 by 2 table or two variables combination, etc., and come with some kind of conclusion. But this is not right thing. As far as possible, when it's available, we should go for multicentric, multivariate analysis rather than the univariate analysis. And if we integrate this epidemiology, when you say that the design of the study usually is a cross-section study or is a case control study or the longitudinal study, etc., the words is intermingled with epidemiology. And in that research also, you need to apply a statistical test of significance based on the type of data available. So if you learn these three things together, then the things is more clearer as well as easier. So as an action point, or a requested to write down one point, I will also write down PSBH, problem solving for better health. And that workshop, I recommend that those who are faculty should conduct this 2 days workshop of PSBH at your college. And the website I will be sharing with you, and also some of the literature, manuals, etc., so that UG students can also enjoy all these three together. The causality is a very important because Ayurvedic doctors were giving his medicine, or allopathy doctor was giving his that medicine, and patient got cured. Because of what? Combined factor or in spite of. Sometimes person say that it is cured because of my treatment, but sometimes it could be in spite of your treatment. So keep these two words in mind, in spite of and because of. So I will just give an example. Professor of pediatrics was approached by a resident doctor enthusiastically. Look, madam, my patient got cured with my formula of giving the IV, the electrolyte, etc. So, madam, look at the dose, etc., and said that doctor, it is not because of your the good treatment, but in spite of your wrong treatment, patient has got cured. So, this causality and the in spite of, we should be clear while we give some judgment or interpretation, etc. A statistics will only tell you whether it is significant or not. It will not tell you it could be the causation or not. For that, knowledge of epidemiology is required. We will also talk of study design. And in this case, you can write again action point that you try to generate a project proposal, write a project proposal and the dummy data at least, if not the possible, the real data, whereby you can almost apply all statistical tests. So there could be the mixed study design also, or you can take a separate project. But in actuality, you need to apply different tests. Now, about sensitivity and specificity, I have just given some kind of video shooting was done just casually, and still I will like to share it. The most important thing is sensitivity specificity. Just increasing the sensitivity might decrease the specificity, and increasing specificity might decrease sensitivity. But there could be something like borderline, whereby you create this borderline in such a way so that most of the cases you can divide into two: highly sensitive, highly specific. But then there is something like borderline. These borderline, if you understand how to create this, the same test, by changing the borderline, you can make the test more sensitive, you can make the test more specific, and you can create a borderline. That borderline you keep on the observation. Instead of spending too many rupees, either you can develop this kind of technique or you can do the test twice if it is a simple one. And then combination of that can also increase sensitivity and specificity. So nowadays, because of multiplicity of the tests, etc., so many lab tests, these words are to be understood properly. So I will share that video and again we'll discuss at some point of time. Outbreak investigation is looking very simple, but trying to exactly find out the which date not only symptoms started, but looking at the incubation period also, when the person must have imbibed the infection. So writing down that and then finding out the index case or index cases will help a lot. And that way it will help you in causation, etc. In COVID-19, there was no combination of the data from all over the world. So I strongly feel that if we have collective data, multicentric data, it will be helping much. So one action point could be one of you can take a lead and try to coordinate the multicentric research among ourselves. Let's say there are 25 participants. So we have 25 centers. And across the 25 centers, if we keep one common database, then within a no time, let's say within 20 or 48 hours, we'll have some kind of research study. And again, action point you can write down wherever you are there. So some of you can involve the UG students, some of you can involve the PG students, maybe 20 PG students or 100 UG students like that. For example, those who are teaching family adoption program is there. So in family adoption program, we can develop a common tool so that in our multicentric research study, we can go for multivariate analysis and can find out even within 48 hours or 3-4 days, a very good study can be done. So in statistics, one should remember the definition of statistics and the mathematics. What is the difference? If I do 1 plus 1 is equal to 2, that is mathematics. But if I do 1 plus 1, instead of that, a figure which is near to the 1, add another figure which is near to 1, it will not be exactly 2, it will be near to 2. If we remember that, that is statistics. It is a science of probability. It doesn't give the exact answer, but probability of answer to be true. And for that, normal distribution curve and p-value, that we are going to learn properly. And for that, again, action point, all of you should be taking at least one kind of measurement in preferably 50 individuals. If not possible, at least in 20 individuals, 50 will be better. Either want to take the weight of the same age group or height of the same age group, or let's say income of the same social condition, or maybe a little bit different. So if you have some kind of measurement data available with you, then if you draw a diagram actually, then the distribution curve, the understanding will be much better. In case of UG teaching, we can go for collation of the data from 100 students, and they can bring the data of 5 families, and then we can plot a normal distribution curve after entering the data into Excel. Looking very simple, but the p-value is really very useful to understand. And then diagnostic pathways, which method to be applied when? That will be using a simple flowchart table, that whether it is to be used a standard error of difference between two mean, or standard of proportion, or standard of the or F test you should be using, or chi-square test. So simple one table, within 15 to 20 minutes, person will be able to find out which statistical test we use. And I think those who are teaching UG or PG, this table should be with you. And then there are so many software available now online, etc. But in this course, I usually use AP Info because it is freely used. It is not charged at all. And that's why, again, write down action point. All your laptop should have AP Info by tomorrow, because the day after tomorrow we'll be doing that exercise also, and we'll be sending you the link if you don't have the AP Info software, the installation. And again, action point, that you are working a lot in the field of medicine, so keep your at least Excel data set ready so that you can start doing analysis with AP Info. And I hope that all of us will be using a sample data, some data file known as Oswego, which is given by the AP Info as a sample file that will be using as a common file for analysis purpose. And as I told you that bi-weight analysis is not enough nowadays, and we should be going for multi-weight analysis also. The thing is, there could be a different platforms nowadays. Something like you are using AP Info, other people are using Excel, the third person is using PHP, etc. So we should know that the different database platforms are there, and we should be able to take help of some experts, say for fetching the data from Access to the Excel like that. But the same format, lesser data are there in Excel, one file here, other file there. Then how to do the relational database, that also we should be knowing. And usually the word used is the relationship relate command is there in AP Info that you should action write down, and relate will help you. Someone is using the mic. You can ask the question afterwards. So relational database, I will give an example. You have a data of 100 villages. Then within village, you have a data of, let's say, 5,000 families, 1,000 families, etc. Within family, you have 10 individuals, that individual data. Now, applying the characteristic of the family to the each individual, and applying the characteristic of the village to individual, that is important, and that you will get in relational database, so that you need not add the data of all the villages under each individual. And this comes so often in data analysis, particularly in community health, that we should learn how to use the relate command. And then critical review and scientific writing. I think all of you must have written at least one research paper. That research paper, if it is already published, I request all of you to post at least one research paper in a group, if not today, by tomorrow, and then we should be able to at least criticize one or two research paper, and that critics will make you more powerful, and that is an action point which you should write down. Now, the topic of project, which project proposals you would like to prepare, and the project proposals should at least budget you should write down is a 30 to 40 or 50 lakhs. You should keep a budget, and we should be ready to send it to the funding agency, and that is compulsory before we give you the certificate. One project proposal. Topic you can decide tomorrow, day after tomorrow, even after 15 days. Action point is by 30th June, you should be ready with your topic, so that at the end of July, you should be ready with your complete project proposal under the headings which we'll be sharing with you. Now I pause here. I just say that if you want to ask intermittently something, you can ask. But at the end of the course on 31st July, all of you should be able to ask at least one question which I cannot answer. So I expect 25 questions which I can't answer, so that those are the areas or development as a participant. So any question? I will pause for 1 or 2 minutes and then we'll move further.
Hi,
Or
sir. Yes,
write
I do
a,
have a question.
yeah,
Yoga Vignesh here. Sir, it's regarding the research topic. So the topic can be on any field, right? It may be on public health research or else clinical research, infectious disease research.
yeah, any topic which you like.
Sorry?
Even it's not necessary that it should be quantitatively. Even qualitative research topic also you can take.
Okay. Yeah, sure, sir.
Yeah,
Thank you.
any topic. Hmm? Any other question?
Sir, I am Dr. Sabre. Sir, I am
Hmm?
from physiology department. So can I take the physiology research paper? Any physiological
Yes,
parameters for that?
yes.
Okay, thank you, sir.
Basically, physiology teachers must go at least once a week to clinics. Must,
Yes.
I not say should, must. So that
Mm,
whatever the parameters which are differentiating, not if it's not a physiological normal, it's a different, right? Whether it's
yes.
a ECG or pulse or let's say hemoglobin, whatever it may be.
Yes.
And then that will be a day where we'll have a very good doctors with us. And
Yes.
physiology teacher teaching in the clinics that this patient is suffering from this, but physiological, these are the parameters which are differing, and these are the parameters which doesn't differ. So
Okay.
that is very good. Anyone else?
Thank you, sir.
I think the chat box is there, and there's a 2 minutes given to all of you to write at least one question. For example, if you do not know, I do not know, I do not know how to ask a question. Ask question. How do I learn to ask question? Can also be question. Everybody, let me know whether you are awake or not. Write down some question in chat box quickly. Quickly write down some. Riddhi is taking a note that no one is writing, so no one is awake. Sandeep, Sudhish, Krishna, how to enter data in Excel effectively. Wonderful. Anything else? In Excel also, now the validation they are giving. So try to use validation in Excel. So that will be very useful. But it is much better if you can know how to prepare the data entry format. In the AP info itself is a program. You should know that the AP info is a program generator with the title or the complete study design. The only title initially, and then the complete study design may be done during July. But by end of June, you should be very clear about your title of the study. Chat box is waiting for your input. Could you please share the link to statistics textbook you mentioned at the beginning of the short textbook of statistics AB Hill? Let me find out if I can find out the soft copy. What will the period of completion of the project? Project can be completed. I wish that within a short period, maybe 2 to 3 months or 6 months. But that depends on you. If you want to take ICMR study for 1 year, that's up to you. But project should be written that before July end. And the multi-centric research study, probably we may be able to do much faster. So we would go more on AP Info which time, right? Yeah, AP Info. Next time I will be starting with AP Info, and because that integrates the epidemiology, statistics, and research. Yeah. So, any more questions? We'll have a workshop of it. It's not a workshop. It's basically a very small software to understand. So within one session or two sessions, you'll be. I would say that confidently that by the 2 or 3 sessions you'll be ready. Our software I will not be teaching that because I use AP Info only, which is very easy. But if you want to learn our software, we can find out the faculty do that. Any other question? Okay, let me now continue with what we are doing. So the even non-parametric tests you should be uh, using because your clinical faculty they feel that they need to take 30 cases and or 50 cases like that. But there are non-parametric tests where even the 5 cases are cancer, you may not get 100 cases, cancer, or maybe rheumatoid arthritis. Such cases you can get, or very few cases. 10 cases given this treatment, 10 the other treatment. In that very small sample size also, you should be using non-parametric tests. I would say that some of you may prepare a need assessment format. I repeat, need assessment format for the faculties. You call it as a faculty need assessment format. If some of you develops that, I can help you, and we float in your college for the all faculties. कि आप क्या जानते हैं क्या नहीं जानते आप जानना चाहते हैं कि नहीं like that, and probably that can be our the one of the main the tool whereby you can assess need assessment across the India. Even if you capture the need assessment of 300 or 400 teachers, that what do they want to learn more about epidemiology statistics and the research method? Probably it will be a great project by itself. So whenever we do the need assessment in the committee or in the faculties or in the population, the hospital patients, you should also try to do the resource assessment. Write down this as an action point. The resource assessment along with the need assessment, that is very useful. Resource in some terms of the money, in terms of the knowledge, in terms of the manpower available, vehicle available, all those things. Now
Okay,
this
offer for the
thing,
road. Offers another.
career guidance, is
Yes,
each individual should, particularly the youngsters, what do they want to do in the future? And that you should be bringing in the group discussion also, so that rest of the people can help you guidance in terms of the academic or research or the community health, like that. And specialization uh, are also now developing, particularly if you go for the agricultural books, agricultural research, they do much more research in a complexity, because in a human being it is very difficult for us to have thousands of population, etc. But they have thousands of seeds, and multiplicity they can do within a few days, or even sometimes few hours. And that's why the agriculture is one of the field where the statistical method are advancing very fast. We have developed several software. In that nutrition software, I will be sharing with you, and the software which is costing 800 rupees, open software, this online software, and there's another offline software which will be working in the Windows only. That is costing 7,700 rupees. Both the software will be given free of cost to you, and you should be installing on the same day, then it will work. If you go for the next day, it will not work. So tomorrow or day after tomorrow, I will share the software, and you will try to install, and you will be able to use it very easily. And AP Info software, by tonight, by tomorrow night, you should be installing. I will be sharing in the group. I have probably shared, but again I will share because of few people join afterwards. Now, as far as the learning techniques are concerned, whatever you learn, try to understand first, and then question of remembering, etc. And those who are interested in home remedies and medicine plant, although it's not a part of this research, etc., but it's such an important thing. So I thought that we will be taking one session on that, an optional session, and it will be beyond this days, maybe in the August or maybe before July, and I'll be talking on that. And uh, in the mental health series and institutes, that will be taking an examples. So it's not at the end of the course in 31st July, you give the evaluation or question, answer, etc. In the group itself, you can give a feedback that you like this, you didn't like this, you would expect this. For example, you want to learn R software. Possibly, if I can catch hold of some person expert in that, we can include. It's not difficult. And this certificate distribution is a bit difficult job, because everybody will not go get on 31st July the certificate. You will get around 31st August or something like that. And few of you may not get if you don't complete the assignments. So I stop the presentation over here. We'll have few discussion dialogue regarding your preparation, what kind of topic you'll be taking, some examples, etc. So now the forum is open for the discussion. It will be good that if you can open up your.
Sir, no voice.
Yeah. I was sorry. I was trying to listen to you, and then I stopped. I was telling that the day after tomorrow we'll be starting with AP Info software, and also some of the epidemiological exercises. Meanwhile, you can have your some suggestions. You can think of some suggestion, etc. Okay, there is no question. Then try to use the write down your uh, pulse rate and age on chat box. I am writing my age and first age and then pulse rate. Let's do one exercise. Quick, write down your age and pulse rate quickly. Try to write age first and then the pulse rate. Okay. Uh, we can see at least that five people are active. Others may not be or may not be thinking what is their age, what is percent. Uh, Let me give you one interesting the example of the p-value. We say that 95% are within the limit and 5% beyond the limit. So if normal distribution curve, if we say that it is talking about the normal things, then 5% this on that side, then there will be 2.5% hypertensive and 2.5% hypotensive, 2.5% diabetics and 2.5% the hypoglycemic, like that. So in statistics, uh, we should remember that the normal distribution curve does not say normal values. That you should remember, because instead of a normal curve, we should be using the word usual curve. But statisticians will not believe us. That's why we are using the word normal distribution curve. Otherwise, if you look at the data, anywhere the data, right? So if you yourself wants to establish, particularly physiology teachers wants to establish some physiological norms, then you should have the three kind of population: people who are hypertensive, and normotensive, by measuring by other parameters. And then if you take these three groups together, so then you may be able to develop the pattern for that. So, for example, we want to establish, I don't know anybody knows in the group or not, what is the normal range or what is the minimum light required in terms of millilux for human eyes to see? I'll write question over here. If you know, you can tell me. Millilux required for eyes to see the object. Not only see, but identify the object. See and identify the object. Now, this data, if it is not there in the literature, what do you do? How to develop that kind of data? Or I will tell you another thing. What are the blinking rates of the eyes per minute at a different age? If you want to establish that, what is the capacity of the muscles or in terms of the per kg or in terms of the time at a different age? So all these are the question whereby you can develop the usual distribution curve for three categories of people: the normal individuals, a bit above normal, and bit below normal. That to be presumed by other methods and then apply over here. So now, if you can summarize the topics, I will tell you some of the topics which you can take right now. The distance what people are keeping between the mobile and the eyes, or angle of the neck which is being kept while looking the mobile. Such thing can be useful to correlate with their neck pain also. Ergonomics is also very important if you go to the banks or in the IT department. Then the hearing loss, that also is very important the nowadays, because the sensitivity of the various senses is decreasing. Not only the specs, which is then eyes are weakening, even the smell, the taste buds are weakening, and that's why more and more salt and the chilies are required by the people. So such kind of topics you can take. Other thing is how much money is spent for which purpose. If you look at that and compare across the study, it will be useful. And the any other question? And by tomorrow or day after tomorrow, start thinking on your the topics. Now chances for you to speak.
Good afternoon, sir. Sir, for physiology, the work is on diabetics is considered as a research paper. As a new methods like vibration perfusion threshold and nerve conduction study.
Yeah. It doesn't matter your physiology or even the 12th pass student can do that research study. It's not that only for research you require this degree. Of course, in your team, one clinician is required if you want to do some clinical study.
Okay, thank you, sir.
Anything else? Yeah, definitely. I will be not only selecting our topic, but collection data, analytics, how you have prepared the right or question or not, whether you're doing proper answers or not. I would definitely request all of you to prepare the in epidemic in the AP Info. You can prepare your software, or you can Google a quiz or Google form. You can prepare data collection form. Can be any kind of thing, but before 31st July comes, at least you try to collect 40 or 50 sample so that the live analysis will be much better. And I request that all of you should try to recruit 5 or 10 or 15 people around. Whatever I have taught you, you try to teach them. What's wrong in that? You can, all of you can write down on your Facebook today that now you are trying learning the epi info, etc. Those whoever wants to learn should provide their mobile. You make your own group like WhatsApp group over here, and then try to go on sharing the knowledge with them and teach them. No problem. We are not saying that we are having a copyright on that. And the literature, while I sharing my screen, you can continue to discuss. I've been sharing this files with you. One thing is the presentation about statistics that I will be sharing with you. Then probability presentation. This is very, very important. Probability, right? So uh, then data presentation. This will be shared with you. Right? And all you don't expect me to everything to go through right now. Here we are there to discuss and find out the faults of each other so that we make more stronger. Right? So before we close, any few more questions? So I think everybody has written down the action points. You'll be going through the website of Problem Solving Better Health. Problem solving for better health. That is 2 days workshop which you should be able to conduct at the end of these sessions, at the end of this course. This is for the UG students, but it can also be done with the PG students, right? You should be able to install AP-Info software from WHO website or CDC Atlanta, latest software. Then another action point, you should be at least one project proposal for research, etc. And there are 2,000 funding agencies who can fund. And then there was another is try to use Oswego file in the sample data given by the AP-Info, right? Then there is something like critics use. I will share with this. Our YouTube channel is a Human Health Circle. That is our YouTube channel. So before I close the session, any question? I'm sure there is a Yoga Vignesh.
Yes, sir. No questions right now.
Yeah, so at least you try to motivate few UG students who learns with you, right? From you rather,
Sure.
so that you can more sharpen your, and wherever the problems come to you, you'll be asking the next session. So see all of you in our next session. And those who have not attended, they may get the see the YouTube video also. That we'll be sharing the link with all of you. Thank you.
Thank you. Thank you, sir.
Thank you, sir.